Hey, thanks a lot for being with us for 2 News at 5 on this Friday. Utah, one of 18 states now in the so-called red zone. A White House task force document made public by the Center for Public Integrity suggesting these states with surging cases should return to more strict precautions now.
We've got to have a delicate balance of carefully and prudently going towards normality and opening up at the same time that we contain and not allow these surgings.
All right, Salt Lake, Washington, Tooele, Millard, and San Juan counties identified as hotspots. Some specific recommendations now dealing with testing include encouraging individuals that have participated in large social gatherings to go get tested, increase messaging to explain the risk of serious disease in all age groups with pre-existing conditions, continue to scale up testing, test households with rapid turnaround testing, and for households that test positive, isolate and conduct follow-up tests. Now, we have a full list of all the recommendations on our website. If you want to see them, just go to KUTV.com. We're also learning from that report today that the federal government did deploy some staff here to support the state of Utah. They sent 2 people from FEMA to support leadership and administrative operations and logistics. They also sent 2 people from the Centers for Disease Control to support epidemiology activities. All right, we have live team coverage with reaction to the Red Zone document. Michael Locklear speaking with business owners and customers. They have some mixed reaction on the recommendations. First, though, we want to go to Brian Malahy. And Brian, this not only the White House report to Utah on corona, not the first White House report concerning Utah and the coronavirus, right?
No, the governor's office says that the state has regularly received reports from the White House. Among the recommendations in this one, close bars and gyms in 5 hotspot counties. But on fighting coronavirus, is Utah doing enough?
I think Utah's doing a good job of staying on top of what needs to happen. As a federal lawmaker, I go out of my way not to tell state and local law enforcement or legal officials, government officials what to do.
I spoke to Senator Mike Lee at a Utah food industry event today. He says it's important to, quote, take into account the consequences of closing anything. Also there, Congressman Ben McAdams, who was hospitalized with coronavirus in March. Do you feel like you still are not 100% over this?
Yeah, I still don't feel like I'm 100%. Today I feel pretty good. But, you know, I think that's the scary thing about this virus is some of these lingering effects can stay for presumably a lifetime.
Congressman McAdams saying that he's about 99%. Those are his words, but he still feels burning when he breathes sometimes. Coming up on 2 News at 6 o'clock, a medical doctor. He's also been a politician. He's a member of the state coronavirus task force, but he says that the task force as a whole has not been apprised of these White House reports. That's at 6. Brian Malahy, downtown.
All right, Brian, thanks. It's important not to confuse these federal zones with Utah's color phases. They're completely different. For the red zone designation, counties must report above 100 cases per 100,000 in population, and the positive results on those tests have to be above 10%. For the federal yellow zone, new cases between 10 and 100 per 100,000 in the population, and a positive test results 5 to 10% range. Now, the owners of some bars and gyms in Utah, they're watching this very closely, this announcement today, and they're watching the surge in cases as well, bracing for what might be coming next. Michael Locklear live in Murray. And Michael, you talked to one bar owner wondering why just a handful of industries are the main target when COVID cases rise.
Right, if Utah followed all the recommendations in this report, then this bar and all the other bars and gyms in hotspot counties would shut down. Now, just in the past half hour, we got some reaction from Mayor Jenny Wilson. Take a look at what she had to say. We'll have the whole thing on KUTV.com, but in part she says, I disagree with the White House's analysis for Salt Lake County. We have taken remarkable strides to maintain pressure on the virus, and preliminary data show efforts are working.
It's got pretty serious. It's not a joking matter anymore.
Some people say gym equipment is spaced out and they want to keep going.
Obviously be smart, be safe. If you feel like you are getting sick, don't go.
But others are okay with a second shutdown of gyms.
I do feel guilt coming here sometimes. It's like mandated, but they're not enforcing it. So there's generally like maybe 3 people in the gym who are wearing masks.
Bars, another industry the feds recommend Utah close to slow the spread of the virus. If there's a second shutdown, do you think some bars will shut down forever?
We're not filling up even to half of capacity because there's so much fear out there. So if we do a full close down, the bars that are already hurting might never make it back.
David Morris owns 5 bars, including Ice House in Murray.
When I see more cases coming out of meat packing plants, which are open, close those.
The feds also suggest Utah restaurants move to outdoor dining, slashing indoor capacity to just 25%. It's a tough call on how to keep Utahns working and safe.
As long as policy is being made responsibly and using data instead of politics or fear, then whatever we need to do.
Now remember, even if a local city or county wanted to implement more restrictions or even a shutdown, they wouldn't have the power. The decisions here on additional restrictions are up to the governor. Live in Murray, Michael Locklear, 2 News.
Yeah, it's a tightrope walk for sure. All right, health officials in southern Utah say they're going to continue to work with any state guidelines. But we did speak with one restaurant owner today who says he doesn't agree with the White House recommendations.
If you're sick, if you're going to be sick, if you're elderly and you're if you're in a high risk category, stay home, stay away. Put a mask on when you go out. Leave the rest of us alone.
Jack Lancaster says another shutdown would cut his business in half again. According to the state health department, 2,300 people in the southwestern Utah region have contracted the virus. 19 people have died as a result of the virus there. An unpublished document prepared for the White House Coronavirus Task Force puts Utah and 17 other states in what they call the red zone. With that comes some recommendations that the states roll back reopening measures amid the surge in COVID-19 cases. If we break that down into counties here in Utah, Salt Lake, Washington, Tooele, Millard, San Juan counties, all in the red zone, while Utah, Davis, Weber, Cache, Box Elder, Summit, Wasatch, Garfield, Beaver, and Kane counties, all in the yellow zone. Now, it's important not to confuse this federal color-coded system with the color phases Utah is using to reopen the economy. They're both different. The federal labels are coming from a new document prepared by the White House Coronavirus Task Force. Utah's Coronavirus Task Force, as a group, apparently has not been getting White House recommendations, including the latest, which puts the state in a coronavirus red zone. Brian Malahy on the story for us today. Brian, the state gets this info, but is the state sharing the info?
Well, emails requested by 2 News show that it is within the state health system and with county leaders. But I spoke to a doc here at UHealth today. He is in the know, and I left with the impression that the state coronavirus task force as a group is not getting this information. The red zone may be a good place to be in football, not so much in the realm of coronavirus. To what degree has the task force been apprised of these reports coming from the White House?
Well, at this point, the task force is really more of an advisory group.
Dr. Brian Shiozawa, MD, ER doc, former state senator, once regional U.S. Health and Human Services director. So you haven't seen these reports from the White House?
Not officially as a member of the task force. I have researched these independently out of interest in my role as a physician.
Emails show a White House official sent the report recommending more restrictions in 5 Utah counties to fight coronavirus to Utah leaders on Tuesday morning. Within an hour, Dr. Angela Dunn sent a series of emails forwarding the document to dozens of others in the state and hotspot counties, calling White House recommendations very pointed and actionable. Shouldn't the task force be seeing this material?
This is important material to see because it does give a nationwide look at where we are.
Dr. Shiozawa reinforces social distancing and the effectiveness of masks indoors in public places. Are you in favor of a state mask mandate?
If I happen to be in a position to make a mandate, that's what I would say. Utahns are smart. They know what to do, but we need to get on the same page in terms of understanding.
Now, to be fair, Dr. Dunn did forward that White House email to at least one member of the state coronavirus task force. Governor, not available today. Lieutenant Governor, who leads the task force, said to be out of state and not reachable. Brian Malahy at University Hospital.
with that red zone designation. The document also lists some very specific recommendations dealing with businesses and social gatherings. They include, to name a few, closing bars and gyms in the hotspot counties that were listed, move to outdoor dining, limit indoor dining to 25% capacity, and decrease gathering limits to 10 people or less. We have the full list of recommendations on our website. You can see those at KUTV.com.